morning, everybody. Thank you very much for coming this morning. I would also like to thank the Hamilton Academy of Medicine for inviting me. My presentation this morning is going to be covering 5 topics. Very little on teeth whitening, a little bit more on dental trauma as it may relate to you, the physician, periodontal disease and its relation to heart disease, lung disease, and low birth weight babies. And I'm going to be spending a little bit of time on cosmetic dentistry and a little bit more time on dental amalgam issues. So as I mentioned, these are the topics I'll be covering, more emphasis on trauma, periodontal disease, and dental issues. My goal this morning is you, the physician, should be able to look into a patient's mouth and be able to pass a comment on their oral health, especially during their annual exams. And also, given the opportunity, be able to look after certain dental emergencies. Let's talk a little bit about teeth whitening because inevitably patients will come up to you and ask you, who is it for? How many types of whitening are there, and how does it work? Well, teeth whitening is for anybody who has permanent teeth and wants to look good and feel good. So, you know, teenagers have permanent teeth roughly around age 13, 14. I never used to do whitening on young people, but, you know, the demand is there. If they want to have it done and it's ethical, go ahead. I also do whitening on 80, 90-year-olds. I used to prejudge. I don't do it anymore. If they want it, they can have it. There are 3 types of whitening. You have obviously over-the-counter products, and I'll get into more detail soon. And you have take-home kits from the dental office, and you have in-office whitening. The active ingredient in whitening your teeth is carbamide peroxide. The carbamide peroxide breaks down into hydrogen peroxide and urea. The hydrogen peroxide breaks down further into oxygen and water. And it's the oxygen that initiates the whitening process. Deeper penetration by bleaching factors break down unsaturated double bonds of the chromophores, which results in its inability to hold color, and as a result you get clear white teeth. One very important fact that you should note is that whitening is very much time and dose dependent. In other words, if you increase the dose of the gel that's being used, you decrease the time that it takes to whiten your teeth. So if you increase the dose from 15% carbamide peroxide to 20%, it'll take you less days to whiten the teeth, but you can bet the sensitivity of your teeth will increase. Now, the sensitivity is not permanent. It's transient. It could be 1 day, 2 days, 4 days. Everybody's different. But if you decrease the dose, it takes longer time to achieve whiteness. But the interesting thing is, the depth or the final result of the whiteness is no different. So one may take 10 days, one may take 20 days, but the one that takes 20 days doesn't mean it's any whiter or less white. So time and dose dependent is an important factor. When roughly, if you, as I mentioned on the slide, if it's 10% carbamide peroxide, the active hydrogen peroxide is only about 3%. So it's a decrease of about 30%. Over-the-counter products, there's tons of commercials on TV. Over-the-counter products include Crest strips, Colgate toothpaste, you have paint-on gels. The big advantage of these things are they're cheap, they're easy to use. Your teeth will turn 1 to 3 shades whiter. But guess what? The minute you stop using it, the color reverts back. So it's very, if you have a wedding, you have an important event, if you whiten your teeth, great, but just realize that every time you pay $20, $30, it does eventually stop whitening. You have take-home products from the dentist. This is where you go to the dentist. They take molds of your teeth, and you get trays to take home. And the biggest problem with the take-home kits is compliance. You're supposed to wear these trays in your mouth for 14 days, 8 hours a day, and nobody does. Whitening is really a cumulative effect, so if they miss 1 or 2 days, it doesn't work as well. So the result is very scattered. I actually, personally in my office, I don't recommend the over-the-counter products. I don't do take-home kits, because when the patient doesn't follow the instructions, they always come back and say to you, gee, it didn't work. So the compliance is a big problem, and I also found that sensitivity was an issue. In-office whitening, this is the best and only way to go, in my opinion. You have a longer lasting, greater depth of whiteness. So you basically go to the dental office. In my office, I put on 38% hydrogen peroxide on the teeth. It contains glycerin and distilled water, so it minimizes the sensitivity, and your teeth will turn 6 to 9 shades whiter in about 2 hours. I also give the patients a take-home kit, so that depending on how much red wine, coffee, tea they drink, or their lifestyle, they can touch up their teeth at home, and you'll pretty well maintain that whiteness. The problem here is you get whitening junkies. Overutilization of whitening products causes what is called a blue tooth syndrome. In other words, your teeth will start to become translucent and have a bluish tinge to it. And your teeth will not look very nice. So people that tend to whiten their teeth for 6, 7 months in a row, and there are, you have to be aware of that blue tooth syndrome. And of course, the sensitivity of your teeth will go up as well. I just want to share something else with you. Everybody's heard of laser whitening, Zoom whitening, Bright Smile. These are all marketing ploys. They really do not whiten your teeth any more than as if you used the gel product alone. In other words, what I'm saying is that if a patient had whitening done with just the gel product, and the other one had the gel product and a Zoom lamp, the person with the Zoom, the teeth will look whiter for about 4 or 5 days, and that's as a result of dehydration. Over the next 4 or 5 days, the tooth will become rehydrated with saliva, and guess what? The whitening will be the same as the person that just used the gel alone. All you ended up doing was paying a lot more money for the so-called laser whitening. By the way, everything I talk about, I have all references, and I've provided the references, so it's not something that I'm just talking. So when you hear about laser whitening or Zoom whitening, these are marketing ploys. They really don't long-term cause your teeth to be any whiter. In my office, the product that I used is Opalescent Extra Boost, and this is the only product that has ever been featured on Oprah. And this is basically 2 hours later, this is the depth of whitening. Now when you whiten your teeth, it makes common sense to have your teeth cleaned, stains removed, otherwise you'll get a blotchy appearance. And I mean, you can see for yourself the results. I'm now going to be talking about 3 types of dental trauma that you may encounter in your office, and then hopefully be able to give some advice to the patient. This young lady was in a car accident, actually in Dundas, and it wasn't the accident that damaged her front teeth. Believe it or not, it was the airbag. The airbag broke her front 2 teeth right off, pretty well midway, and she had a lot of bruising. I didn't show her face, but basically all I did here was reassure the patient and restore the teeth with composite resin, just white fillings. And I made it look, as you can see with the reflections and anatomy, made it look fairly natural. So she thought, she's about 20 years old, she thought it was the end of the world. And I was able to reassure her that, everything will be okay. This gentleman had an accident at work, and the tooth was broken off right at the gum line. So the first thing you may think of is extracting the tooth. I mean, that was an option I gave to the patient, but I said, I can perform root canal treatment. And once the root canal treatment is performed, I'm sorry, I don't have the slide, but there is a post that I put right into the root canal system itself, and followed by a crown. And it's, if you take a tooth out, the bone collapses and you don't get a very nice result. So I was able to explain everything to him, and you can see the result for yourself. So if you run into a situation like this, you can kind of reassure the patient that there is a possibility you can save that tooth. This lady was playing baseball and she got hit in the face. And the result was her upper right lateral incisor was knocked out or avulsed, and the central incisor was fractured. Success of treatment for this patient is very much time dependent. Reimplantation of the tooth within 30 minutes gives you very good prognosis. So if you're at a sporting event, at your kid's basketball game, hockey game, or if a patient calls you and you're given the situation that a tooth's been knocked out, what do you do? As I mentioned to you, time is a big factor. The first thing you need to do is hold the tooth by the crown. Do not hold the tooth by the root. And examine the root. You want to make sure there are no root fractures. If there's a root fracture, the tooth is history. If upon your examination you notice that the root is intact, rinse the tooth with bottled water if possible. If you have tap water and no bottled water, use whatever you can. And try to reimplant that tooth. Now, you might feel a bit squeamish about doing it, but believe it or not, when you put that tooth in, it actually snaps right back in. So reimplant that tooth. If you can reimplant that tooth, refer it to the dentist right away. If reimplantation is a failure, this is what you need to do right away. Place the tooth in saline solution. If you don't have that, put it in cold milk or saline gauze. Believe it or not, even under the tongue of the patient is a good place. And the last resort is cold water. And refer it to the dentist immediately. There are failures that I've had with reimplantation if it goes 40, 50 minutes. I don't know why, but 30 minutes seems to, success is very high, whether there's rejection or not. So in this particular case, I was able to reimplant the tooth, the lateral incisor, followed by root canal treatment, and followed by, I'm sorry I can't see it very well, but the root that was broken here, I was able to remove the piece. And this lady's got her teeth. This was, again, an accident case that I did not see it for a while. The two teeth were lost. I actually put in a temporary denture just to allow for healing. And once the healing took place, I was able to do permanent crown and bridge work. Actually, I whitened her teeth first and then did the bridge work, which is permanent, to match with her existing color of teeth. And she can bite into apples and do whatever she wants. What I'm now going to be talking about is periodontal disease and its relation to heart disease, lung disease, in particular pneumonia, and low birth weight babies. What is periodontal disease? Periodontal disease is an infection of the gums and bone caused by bacteria when allowed to colonize. The bacteria release acid and inflammatory mediators that cause bone loss and eventual tooth mobility and, at the end, tooth loss. So periodontal disease is an infection. People sometimes don't understand that, just like caries or cavity is an infection. The symptoms of periodontal disease are red, swollen, tender, bleeding gums. Red, swollen, tender, bleeding gums, bad breath, and mobility. It's very interesting if a patient or a person has a bleeding nose, ear, finger, they'll do something about it right away. But if they have bleeding gums when they're brushing their teeth or they're flossing, they ignore it. It's so simple, but I just can't phantom that they'll do something, they'll go get a bandage if they have a bleeding finger, but they have a bleeding gums, they think it's normal. This is hard to believe in this day and age. I mean, I saw these two different patients very recently. Periodontal disease is very prevalent in North America. 75% of the population suffer from some form of periodontal disease, whether it's from mild gingivitis to severe periodontitis with bone loss. An interesting fact is people think when you floss your teeth that you're cleaning your teeth. The brushing cleans all surfaces of your teeth, and when you floss, you're actually mechanically cleaning your teeth. That's not true. The benefit of flossing is twofold. One is that when you floss, you allow oxygen to get between the teeth for a nanosecond, and it kills the bacteria that causes periodontal disease and caries. So that's one benefit of flossing. The second is that it prevents colonization of bacteria. Bacteria running around in the mouth is fine, but if you don't brush for a day or two and you allow colonization, that's when destruction takes place. So flossing prevents colonization and hence gum disease and decay. People with chronic gum disease have a higher risk of heart disease. And the theory behind this is that bacteria from the oral cavity enter the bloodstream and get attached to the plaques in the coronary artery, and they start to cause occlusion. As well, bacteria release pro-inflammatory cytokines, which elicit effects associated with arteriosclerosis. Again, there are many studies I can refer to if anybody needs them. People with chronic gum disease are also at a higher risk of pneumonia. And the theory behind that is that when you breathe, you aspirate fine droplets that contain very large amounts of bacteria from the mouth into the lungs. Once in the lungs, they multiply and breed. So for an elderly person who has lowered resistance or is immunocompromised, this can be fatal. So the mouth acts as a toxic reservoir of bacteria. People with chronic gum disease have a higher risk of low birth weight babies. And again, the theory behind that is that the bacteria crosses the placenta barrier and affects the newborn. The types of bacteria that are implicated in periodontal disease is as above, but the most virulent bacteria is the gingivalis and the actinobacillus. Did you know that diabetics are very prone to periodontal disease? This is as a result of the thickening of the microvessels in the oral tissue, which results in decreased oxygen and nutrients to the tissues and removal of the waste products. The other issue is you have impaired neutrophil function, which results in decreased phagocytosis, decreased chemotaxis, and an increase in superoxidase release, which all causes the periodontal ligament to break down. Okay, a little bit of fun. Heart disease and gum disease did not kill these young men. Something else did. Poor guy. She had her lips filled, I think, but anyway. Okay, cosmetic dentistry. Cosmetic dentistry is basically destroying one's natural tooth structure and replacing it with something that's more pleasing to the eye. while as aesthetic dentistry is modifying one's natural tooth structure and replacing it with something that's more pleasing to the eye. Cosmetic dentistry is really destroying the tooth. I don't do much of that. I do more of the aesthetic. Obviously, to do a smile design or creating the best look you can for a patient, you need to do a workup, and this is all part and parcel of it. This is very important and interesting. When I create or design smiles, I try and incorporate these 7 design principles, and I'm not going to bore you with the 7, but what's very important in a smile, and you guys are all going to start looking at each other, because the most important feature about a smile is your maxillary central incisor. It's the most important part of that tooth is actually the size and the shape. Did you know that the distance between the bridge of the nose and the tip of the chin, whatever this distance is, 1/16 of that is the length of your maxillary central incisor. And whatever that length is, 3/4 of that is your width. So for example, if the distance, my distance between the bridge of the nose and the tip of the chin is 16 centimeters, then of course the length of the central incisor will be 1 centimeter. And the width of that central incisor will be 3/4 that, or 7.5 millimeters. For your information, the average length of a maxillary central incisor is around 10.5, 10 3/4 millimeters. So there are things that I try to incorporate in designing smiles, and if you can incorporate all 7, you're firing on all cylinders. Sometimes you can, sometimes you can't. Before I do any case, I always show the patients a mock-up. I don't like computer-generated before and afters because I can't do what a computer does. And I haven't been sued in 25 years, and I don't intend to be sued, so I do what is a wax mock-up. And this gives the patient a good idea of what the final result is going to look like. I have never and will never do a case without doing a mock-up. The patient basically has to approve what they see. This is some of the results of the cases that I've worked on, and I'm sorry I can't see very well from here, but basically this patient's chief complaint was hypocalcification or chalky marks on her teeth. She wasn't happy with the shape of the teeth and so forth. So what I did for her was whiten all of her teeth, and then I did 10 veneers. And if you look, it's not just the teeth. The gums have to be symmetrical. The patient's right side has to be symmetrical with the left side. And I use a laser, a soft tissue laser, to create that symmetry. It's important to shape the gums in a particular way and make them look symmetrical. This lady, believe it or not, came to me and said she wanted all her teeth removed. And she hadn't been to a dentist for 20 years. She lacked self-esteem. She was just not happy with herself. And I just told her to give me an opportunity. So long story short, I didn't do veneers here. There's a special material that's very translucent, very vital, very alive, called zirconium. And I basically did zirconium crowns on her, so you can see the difference. This is not just whitening. This was another case that was actually featured on CHTV. This is a lady from Milton. She had jagged, long teeth, an old crown, and so forth. And there's her final result. This was another case, a carpenter that came into the office. He hadn't been for a while. He had 4 daughters. He got them all looked after. But you can see their short, worn teeth, decay everywhere. And that's with him before. And it took about 3 months, and I fixed his teeth. One of the benefits of doing cosmetic dentistry is function. When you can restore a worn dentition, you definitely improve function. With improved function, the patient can chew better, they can digest their food better, and obviously the absorption of nutrients is better. Okay, my final topic, and believe me, I can talk an hour on each topic, so I've condensed everything. So I'm now going to be talking about amalgam, and in particular, the composition, its alternatives, the primary concerns about amalgam, and what does Health Canada state. Amalgam consists of 50% mercury. The rest is silver, tin, copper, zinc. Amalgam has been around for 150 years and it's still being used today. Anybody knows of another product that's been around for 150 years and it's still being used today? Well, it's Coca-Cola. So those are the only two products that I know that have been around for 150 years and it's still being used today. The three concerns about mercury fillings are as follows. The first is, over time, as you eat and drink hot and cold foods, the mercury fillings contract with cold temperatures and expand with warm temperatures. As they contract with cold temperatures, they actually pull away from your tooth or enamel. When they pull away, there is space created, and bacteria, which is present in everybody's mouth, seeps in between the tooth and the filling, and the result is recurrent or decay under the amalgam. When you have warm things over many years, the mercury fillings expand, and when they expand, they fracture teeth. And the result is, again, seepage of bacteria and decay under the restoration. The second concern is that politically, there's an atmosphere in the community that mercury fillings are not good for you. Well, nobody has ever proven amalgam or mercury fillings are good for you or bad for you. But having said that, most countries in Europe have banned amalgam or mercury fillings. In my office, I can't take mercury fillings removed from patients and throw it on the sidewalk, in the garbage, in the toilet, in the sewage. I can't. I'll get a big fine. I have a guy come in every month, take out the waste, burn it in a special furnace. But imagine, I'll get a fine if I throw it somewhere, but I'm allowed to put it in your mouth. You know, there's a little bit of a hypocrisy there. I haven't done mercury fillings for 15 years. I just have my own feelings about it. The third concern is that environmentally, to produce and remove these mercury fillings, you're polluting the water and the air. The biggest advantage of alternatives to amalgam are threefold. And this is referring to composite white fillings or porcelain. Here are in my opinion, the biggest advantage of alternatives is they stick to your teeth. Mercury fillings do not stick to your teeth. They are mechanically held in place. And like I said, over time, they loosen up. But white composite fillings chemically and mechanically stick to your teeth. So there is no leakage. There is no contraction or expansion. So that's one. Two, they look natural. Three, they're supposedly healthier. Nobody has proven that they're unhealthy. Who knows what will happen in another 5 or 10 years. But the main thing I want to emphasize is they stick to your teeth. Mercury fillings do not. Well, what does Health Canada have to say? Health Canada basically states that don't do mercury fillings on children that are less than 12 years old. They recommend that you don't do mercury fillings on children less than 12 years old. They also recommend don't do mercury fillings on pregnant women. They also recommend don't do mercury fillings on people with kidney impairment. Well, the way I look at it, what about the rest of us? What do you consider, or what would you consider is the normal mercury level on a North American adult that has, say, between 4 and 6 amalgam restorations in their mouth? What do you think would be, any idea, any numbers, what is considered the normal mercury level found in a North American adult with 4 to 6 amalgam restorations? Well, let me share that with you. It's 3.2 micrograms per liter of urine. 3.2 micrograms per liter of urine. Studies have shown that toxicity symptoms start at about 50 microns per liter of urine. Okay? Now, I have something very interesting to share with you. If your mercury level was 3.2 and you did not have any more amalgam restorations placed in your mouth for the rest of your life, the amount of mercury level in your body would increase substantially because of chewing, grinding, and leakage. The symptoms of mercury toxicity are tremor, headaches, insomnia, weight loss, slow nerve conduction, depression. So coming to actual cases, when you look into a patient's mouth and you see the grayness, is it working? You see the grayness around the mercury fillings. Once the mercury filling is removed, you can see the decay that's underneath. This is a very ideal case. If you look over there, the mercury fillings are pulled away from the tooth. There's fractures here as a result of expansion. Here it's from contraction, and again you see the leakage. I have fixed thousands of mercury fillings, and I'll tell you, I've never found one without decay underneath. So again, the composite fillings stick to your teeth, they look natural, and supposedly they're healthier. This patient was not in pain. When he came in, I explained to him, showed him what's going on, and when I removed them, look what's underneath. So they look intact to the naked eye, but in fact, that was underneath. And that was restored by composite. Now, I'm not suggesting that you all run out today, go to your dentist and get your mercury fillings removed. The purpose of this was to share what's going on. You know, as the time comes when the restorations are worn or had its lifespan, you may want to consider what are the alternatives and the reason for it, and you can share that information with your patients. I'd like to thank you very much for your attention and allowing me to speak to you. If there are any questions, I can take some, but I am on booth 13, and certainly I can individually talk to anybody. Thank you very much.
One of the common problems that we face are patients with bad breath, and whether it's dental or whether it's something else. Certainly we know there's a lot of health problems that create bad breath, but from a dentist's point of view, what's your approach? Should we be taking out our amalgam fillings?
Okay, no, bad breath is really caused by, the most common is poor oral hygiene. That's one. Two, a lot of patients don't brush their tongues. A lot of microscopic food particles remain on the tongue. Bacteria utilize it and release products that cause the bad breath. So brushing your tongue is an absolute must. And the third thing is I found that people that have a regurgitation problem, acid reflux, they also tend to have bad breath. So, whether antacids or seeing a gastroenterologist to fix that. Those are the three things that I find most common. Okay?
Thank you very much.